Assalamu alaikum.
Assalamu alaikum warahmatullah. So today's topic is the cracking pathology MCQs. The first thing which I want to mention here is the time division. So there is actually the 3 hours for you to complete your exam, and this exam will be consist of the two parts. One part will be the biochemistry, 45 marks, and the other one will be the 45 marks for the pathology. So in the same manner, there will be half 45 MCQs for the biochemistry and 45 for the pathology. So then the tips for the time management, that it is advisable to you that please spare 10 minutes for the paper distribution. Like it will take some minutes for the invigilators to distribute the papers to you, and then you have to fill up the details of your paper, like your name, your roll number, your signature, and other such details. So then you must also spare 10 minutes for the rechecking. Like paper rechecking, it is very important for you that whether you have completed all the MCQs or not, or maybe there are some MCQs are left. And then the remaining time will be the 160 minutes. And if we divide these minutes, it will be the 80 minutes for one subject, like 80 minutes for biochemistry and 80 minutes for the pathology. And then at the same time, if we get the time, we calculate the time for one MCQ. So it will be actually the 1.7 minute or the 106 seconds. So you must be very sure about the time calculation. So the first of all, we must know the paper setter, that who is preparing our paper. So if we know about the paper setter likings and dislikings, so it will be easy for us to get good scores. So here the situation is very different. Like most of the students, they are not familiar with the paper setters. So University of Health Sciences Lahore is actually the member of International Medical University Association, and they have an international MCQ bank. So they ask every university to contribute and to make MCQs and give them, and they fed in their database. So that database is actually the software base. So whenever some university requires some MCQs or some exam, that university requests that organization, and that organization use that software and generate three copies, or you can say the three different MCQ papers. And then the controller examination randomly pick one MCQ booklet, and it will be your, you can say, the MCQ exam. And those MCQs and MCQ database and bank is based on the international textbooks like Robbins Mythology, and rarely sometime the review articles from high impact factor journals like Nature and Science. So then the types of MCQs, first of all, there can be MCQs on the basic definitions. It can be what is the definition of pathology, oncology, or here I give one example, that cytopathology is the study of what thing. It is obviously the cells. So some type of MCQs will be based upon the definition. Then in some MCQs they will be asking about the basic pathological terms or the basic terms of the pathology, like hyperplasia, dystrophy, hypertrophy, atrophy, anaplasia, blah blah blah. So here is the hyperplasia is referred as, there will be four options and you have to select the right one. So then there is another type of MCQs. It is the based upon the pathological pathways. Here is an example of the exudate formation, that how exudate form. An exudate is formed in, so there is a blank, then because vascular permeability increases as a result of the increase in the interendothelial spaces. So there are four options: inflammation, apoptosis, atrophy, and senile atrophy. And you have to choose the right one. So then the very famous and notorious type of MCQs, clinical scenarios. In clinical scenario, they will give the signs and symptoms or the prognosis of a patient, and you have to choose the right answer. So here is an example of a 48-year-old woman has a malignant lymphoma involving lymph node in the para-aortic region. She is treating she is treated with a chemotherapeutic agent which results in the loss of individual neoplastic cells through fragmentation of individual cell nuclei and cytoplasm. Over the next 2 months, the lymphoma decreases in size as documented on the abdominal CT scan, by which of the following mechanism has her neoplasm primarily responded to therapy. So there are five options given here: coagulative necrosis, mitochondrial poisoning, phagocytosis, acute inflammation, apoptosis. So here you can find some keyword like the fragmentation of individual cell nuclei and cytoplasm. So it is a characteristic marker of the apoptosis. So here you can find the answer. So this is another type of MCQs which you can get in your exam. The last one is the out of context. Actually, these type of MCQs are not out of the context or not out of the syllabus, but student think. So it can be some MCQ like one very simple is here. Gram staining is based on the staining of cell wall, cell membrane, flagellum, endospore. You people already, I think, read about gram staining in your intermediate, but there can be some very tricky and really very difficult questions. You may encounter such type of MCQs in this type. So these are actually the four different types of MCQs which you usually get in your MCQ paper. So the attempting strategies that how we should attempt the MCQ. So one is the read and hit, and second is the read, repeat, and fill, and then the hit and trial. So I personally like the read and hits. Like when I will get a MCQ booklet, I will start reading the MCQs. For example, the first one was about the atrophy and I know the answer, so I can fill it. And then I will go to the next MCQ. I know its answer, I filled it. Then MCQ number 3, 4, 5, 6, I don't know their answers, or I have a doubt, so I will skip them. And then I will move on. Maybe the seventh MCQ answer I know. So when I'm reading the MCQ booklet, I will start attempting. So maybe in first spell, or when I read the MCQs for the very first time, maybe I am successful to solve 10 answers. So now I am left with 35. It will obviously save my time. And when I will read again, then I can attempt other remaining MCQs. And there is another strategy: read, repeat, and fill. So the students mostly they read all the MCQs once, then they read again and again, maybe 2 times, maybe 3 times, and then they started filling the answers. So it takes some time. So it depends upon your taste and choice and your experience. And then the final one is the hit and trial. So it is for unfortunately some poor students who don't know about the answer, who are not familiar with the answer, so they just randomly pick the answers and fill. So then the points to remember, the important points you must remember during solving the exam. So first one is write complete name and other details, your registration number, your roll number, your signature. These are very important. The second one is must read and follow the exam instruction. If they are asking to you for using the lead pencil, so you must use lead pencil. If they are asking for some permanent marker, you must use permanent marker. It is very important. Then the check the paper sequence. Like for example, if your first 45 MCQs were for biochemistry and next were for pathology or physiology, whatever it is. So you just started you're attempting your pathology MCQs, but the first pathology MCQ is actually the number 46. But on the answer sheet, you fill the point one or the first answer. So in this way, you will wrongly mark all of your answers. So you will be in a very difficult situation. So you must check the question number and must attempt according to question number. Then fill all the spaces. Don't skip, like it is also written on the your MCQ paper that please fill the circle completely or square, whatever it is. So you must fill. Then you must look for the choose the best. So many times the MCQ options are choose the best. All the answers are true or all the answers are okay, but you have to choose the best one. So don't miss this point. So if he's asking for the best answer or choose the best, so you must choose the best. Then spare some time for rechecking. It is very important. And then do not miss any question, whether you know the answer or not. You can understand the question or not, but you must fill all the question answers. And then do not exceed from the time limit allocated for MCQ. For example, we have 110 seconds for one MCQ, so please fix try to finish that one MCQ, because all the MCQ carry same marks and they are equally important. So if you don't know the answer of one MCQ, don't waste your time on reading that MCQ again and again. Rather than doing this, skip to the other answer or the other question, and then when you have your rechecking time, you can give more time to that MCQ. So here are resources of practicing MCQs. So recently in this year, we published one MCQ paper, an easy approach to pathology and laboratory medicine. So here are more than 4,500 MCQs. It is actually especially for the MLT students, but it do carry the MCQs in anatomy, physiology, biochemistry, and the basic medical sciences. So you can buy this book from the Prince bookshop or some other, or the Said Book Bank or any famous book distributor or bookshop. And then there is the you must follow the textbooks like Robbins Pathology. There are summaries at the end of every chapter or every topic, and then there are tables. And some pathology books they also give some MCQs. So you can also follow those MCQs and you can practice. And then the next one is a WebPath website. So which I will show you now. So here is a WebPath. So when you will write on the web path on the Google, you will get this thing, and here you can click the web path, or you can directly go to the exam main menu. Here you clicked. Now you will be having a lot of different contents. So you can select the journal and special topics in pathology. So here you will get the MCQ subsets of like cell injury, embryology, immunopathology, inflammation, neoplasia, nutrition, arteriosclerosis. For example, you are opening neoplasia. So here you will get the question. So you can read the question and you can tick it. So here it will tell you why it is incorrect, and here you can calculate your score. And you can also use some stopwatch for calculating your time. So whatever the answer, correct or incorrect, they also have given the description. So that was from my side. If you people have any questions, you are welcome to ask me.
Sir, there was a question which is being asked there. Can I present it in front of you?
Sorry, Hira, I cannot hear you properly. There is some retardation from your side. Voice retardation.
The question is that there is a lot of syllabus and the time is also so less. So how can we cover that syllabus? And it
So
was not covered completely.
here is also some text box. So if you people have any question, you can write here and I can answer, or otherwise you can submit your questions and I can reply later, whatever you like. Hello, can you hear me? Hello.
Yes, yes, sir. Can you answer the question which is being asked?
I cannot hear you properly. Your voice has some retardation. So I think it is enough. So we already took a lot of your time. Maybe we can have the question and answer session later, or you can make some WhatsApp group and there we can answer, or any other way. Yes, how can we cover syllabus time in less? So you must follow, first of all, you must follow the textbook. Don't go for some creepy helping books, because whenever you are appearing in UHS exam or after UHS exam, you are going to appear in some job test or you are applying for some international licensing, those MCQs will also be based upon the textbooks. So first of all, you must follow textbook. Then the textbook, if you count the pages of the Robbins pathology according to your syllabus, they are maximum 90 pages, 90 to 100 pages. So I don't think so that 1 year is less for covering 100 pages. Okay, now you have only 2 months or 3 months, so 100 pages are nothing. There will also be blank pages, there also be big diagrams, there can also be tables. So if we more you can say make it concise, so there will be actually 50 or 40 papers. If you compare these 50-40 papers with biochemistry course or written the physiology, pathology is a very concise and very short syllabus. So you must divide the topics, or you can divide the chapters and you can cover them. You can follow the tables. If you don't have time, you only read the summaries and see the tables and diagrams. That will be the enough for you. So I think this is the easiest way to cover the pathology syllabus. So any other question? So is there any other question? Hira, is there any other question? Okay, so thank you very much for your time, and I'm really very sorry for the, we can say, that discontinuation in the video. There was some problem with my Wi-Fi router. So thank you very much.